Hi, I'm Jeannie Lavery, RDA. I'm one of the clinical trainers at IntelliScan 3D. Today I'm going to show you some tips and tricks on how to use your IntelliScan 3D scanner. So we are going to be scanning the patient for an oral health report or a treatment plan with the IntelliScan 3D. I'm going to scan the patient's full arch scan. I can also use the IntelliScan 3D as an intraoral camera to capture individual images, and those can be used in insurance claims or to create the oral health report. So first I'm going to start on the patient's mandibular scan. I also want to point out that when we're scanning, make sure that you're in a comfortable position, that the patient is either supine or upright, whatever is most comfortable for you. For me, I like to have the patient sitting upright. It helps with saliva and the tongue will rest at the floor of the mouth. It makes it a little easier. I can also command the wand from the button to start the scan. So I'll have you turn towards me just a little bit. I like to always start on the lower right. So I'm going to start on all of the occlusal surfaces, skimming across to those incisal edges, and then posterior on the occlusal surfaces. When I get back to the last molar that's on that left side, I roll into the lingual. We want to make sure that when we're scanning the lingual surfaces, we do rotate the wand as much as we can to that 90-degree position so the lens is pointed straight at the lingual surfaces. That helps the camera to be able to see around the curvature of the teeth and get in those embrasure spaces. Now I'm on the occlusal posterior and I gently roll out to the buccal. And now I'm going to bring the wand forward. Notice how I come forward and I keep the wand position at a horizontal angle, just like a flute. I can remove the wand from the patient's mouth and then go back to one of the surfaces on the occlusal where I first started. And notice how the system quickly picks up information where I already have some existing data. Again, keep the wand in a horizontal position. It helps so it doesn't create the double surfacing. Now I'm just looking around and supplementing the data, seeing if I have any holes that I'm missing. I can click the button on the wand to pause my scan. And now I can also use the motion sensor by clicking the button on the wand 2 times. And then I can direct on the screen whether I want to add more scan data, whether I want to back up or accept my scan. I can also point the wand tip at my laptop straight up to the eye. Hold it there until it makes the selection, and then with the tip of the wand, I can rotate the scan around on the screen and not have to reach over and touch the keyboard and cause cross-contamination. I can also hold the button on the wand in, and it will end the scan. So now I'm going to capture the maxillary arch and then the bite scans. Again, the scan path, occlusal, skim across those incisal edges, and then on the occlusal again, all the way posterior, occlusal, and when I get back to the posterior, go to the lingual. Really making sure that the angle of the lens is pointed in to that 90 degrees so that it can see in those embrasure spaces. All the way. Then I can rotate up and close down a little bit. Rotate out to the buccal. And also notice I am rotating the wand to that 90-degree buccal angle while I pull the wand out of the patient's mouth. Capturing the facial surfaces and making sure that I'm capturing at least 4 millimeters of gingiva above the teeth there. We also want to make sure that we capture the incisal edges, so we want to complete our rotation when we're going over and filling in the voids. Take the wand out of the patient's mouth, let them swallow if they need to. One of the really great things about the IntelliScan 3D is that it scans so easily without having to have the environment completely dry or have lip and cheek retractors to be able to get a good scan of the patient. Go ahead and close down a little bit. So again, I'm going to come around, keeping the wand in that horizontal position like a flute, getting the gingiva and rolling over the incisal edge. So I see some areas that I need to fill in, and I can click the button and then I can go back and preview. I'm going to end my scan by holding the button in, and I'll capture 2 posterior bite registrations. I'm going to start on the right hand side. Go ahead and place the wand and then, bite together. Then I can click the button. It's a vertical swipe up to the gingiva and down to the gingiva, and then you can click the button. Once you notice that the upper and lower arch merge to the center of the screen, you know that you have enough data for the system to articulate the 2 arches. And bite together. Click the button. If you need to add an additional bite, there is a plus sign. So if you want to add an anterior bite, you can. We also, I'll go ahead and add that anterior, and then it'll orient the teeth here. At this point, we can also roll the scan down and look at the internal. We can see where the patient is actually in occlusion, and we can also use it as a tool for checking for occlusal clearance. So I'm just going to hold the button in to finish the scan. So now I'm going to do some individual images for the oral health report. So to use the IntelliScan 3D as an intraoral camera, I can push the button to capture the images. So we can go around the patient's mouth and identify some areas of concern and take those images and add them to the report. Click the button. You can add the tooth number. These are some pre-populated conditions that the system has already. You can add additional notes later to the treatment plan. After you capture individual images with your IntelliScan 3D as an intraoral camera, we can also add screenshots of your scan to the treatment plan report. You can upload panoramic images, CBCT scans, and you can do some editing on the screen for the patient. And at the end, we can hit the preview button and it creates the oral health report. On the oral health report, it has all the basic information: patient name, the clinic name, the date and time that the report was taken. It also does screenshots of the STL files. And if you add a image, a radiographic image, it also can be uploaded as well. So once you capture all of the necessary information, you can share this information with the patient via a QR code. They can open their camera on their cell phone and it will scan the code and put that report right directly on their phone. Then they're able to take that information home with them and they have a full understanding of what that treatment plan is that the doctor found that day.